Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, All right, hello. Welcome to another episode of Telehealth Tuesday. This is your go-to podcast for modern insights on wellness, healthcare solutions. I'm Dr. Michael Bookhart, your host, and today we have a very special episode lined up just for you. Now, I want to let you know that Telehealth Tuesday can be viewed on multiple platforms. Our YouTube channel, first Instagram, Good Faith Wellness Center, and also Facebook, Good Faith Wellness Center, but also, and most importantly, Dr. B TV on YouTube. That's right, Dr. B TV. The word doctor spelled out DOCTOR. The letter B is in boy, TV. So please make sure to follow, share, tag, like, and most importantly, click subscribe to help support this amazing program. Tonight, you, fortunately or unfortunately, either way, stuck with yours truly. We will start having our regularly scheduled guests on the next Tuesday, next week, God willing. So we want to start by letting you know that Good Faith Wellness Center is accepting new patients now. That's right, Good Faith Wellness Center. Now, if you have insurance, then that's great. Then we can stop there. We take each and every one. That's right, every single insurance payer, we take it. That's when you're coming to see Dr. Bookhart. We wanted to do that to make sure that nobody had an excuse to not see the doctor. So every single insurance company, doesn't matter. We will find a way to make it work. If you do not have insurance, then it's still all good, even better, because we have 3 very convenient payment plans. $99 a month for single or individuals, $99 a month, which I'm sure is cheaper than most people's cell phone bill. For $99 a month, you can come for unlimited visits. That's right, unlimited meaning unlimited, meaning as many times as you want to see our smiling faces, you can come to see Good Faith Wellness Center, whether it's to have actual health care, to have a checkup done, get your lab work, or if you just want to sit and look into our smiling faces, then we welcome you. So please make sure. And also for couples, $179 a month, family for $229. Again, I'm sure this is cheaper than your cell phone bill. So make sure to make your health a true priority. And at Good Faith Wellness Center, we want to make sure that no stone is left unturned, and nobody is left with any excuse why they do not have a compassionate primary care provider. And so we're happy to see you, and we are taking new appointments. The phone lines are open as soon as 8 a.m. or 7:30 a.m. tomorrow. So just wanted to do a little bit of housekeeping. Now, just to let you guys know, this is a live episode, and so we want to hear from you, to all those that are out there in Facebook land, that are there on YouTube, Instagram, or following us on LinkedIn. We are broadcasting simultaneously, so I'm going to go back and forth from Instagram into the other networks. So make sure that if you have any questions, this is the place. This is the place where if you possibly don't have access to a primary care doctor, or don't, maybe just don't feel comfortable talking with your doctor, well, we are here for that. So that there's no bad question. This is the one time when we can say there's not a bad or a dumb question now. That's very limited, but this is the one time, okay? I see my lovely mother, Dr. Lily James, is watching. We're always so glad to have her. Round of applause for her and for yourself. And so we are so glad that she is here in the land of the living and with us on tonight. All right. So we're going to go ahead and get started. We've got some things lined up for you. We've got a couple of icebreakers as well. And one of the things that we wanted to discuss in terms of an icebreaker, we want to hear from you about the one. Last time, I believe we talked about the one health habit that you need that you know you need to change, but have not. So we wanted to follow up on that and see if anybody has anything that's on their mind or anything that they would like to discuss, or even to talk about that. You know, the one health habit that you have, or this one habit that you need to break, or why you haven't been able to. So we want to put that out there as you guys continue to log in. We're going to give you a few more moments to log in. So we are waiting for you guys to come on in. Let's see, out there in Instagram land, I see a few people out there. I don't know if you're still out there. I see my frat brother Fred Terry from Sigma Lambda, the staple chapter of Alpha Phi Alpha 06 in the building. So if you're still there, man, drop us a line, Fred, in Instagram land. Let's see, we've got a couple of announcements. So we wanted to talk about that. And also there are some other hot topics in medicine. A lot of people are talking about, they want to know about the COVID vaccine. Is this something that you should take? A lot of people don't know, but they actually unofficially silenced me a few years ago because, and we won't even get into why, but there are the powers that be, and that my previous employer informed me that I was not cleared to go on the news and answer questions about it. And as you all know, COVID was extremely controversial back then. But nevertheless, since we are not yet a syndicated program, and we're doing this all out of love and to give back to the community, that means that we can say what we want to say. So, which is still quite a blessing. And so, if you have any questions about that, we would love to discuss that. And it's just 1 second. We've got a couple of questions coming in just now. We've got a few questions. 1 second here. Okay. All right. We got to bear with us just 1 second here. And make sure we want to hear from you to ask your questions, as we've said. And so if there's anything that you have always wanted to ask, or haven't had the chance to ask, or you don't have a doctor, and I always tell people, well, you have one now. And so we definitely want to hear from you. Let's see. Okay. We're going to get that question on there. We will make sure to get that one. Okay. All right. Okay. 1 second. All right. So one of the questions that comes in, the number one reason why people avoid even going to the doctor, the number one reason why people avoid going to the doctor. And I think that's that's a multifaceted question. There's a lot of layers, a lot of things to unpack there. And so we're going to get into that. And just so you guys come on in, I see a few more people logging in. You guys come on in. We want you to log in for the, let's see, and got some more questions there. Okay. Another question coming in about, are annual physical exams still important if you feel healthy? Now, that is an excellent question. So and if anybody wants to chime in on that, we'd love to hear from you. But we're going to get that on the screen in just a second here. Let's get that on the screen. Okay. So we've got two things. The first thing that we want to tackle is this one. This is our audience icebreaker, where we're asking you all what the one health question that you've always wanted to ask a doctor but never have. The one, and so that's going to have to come from the audience. When the more the more of our viewers and supporters would log in. So we'll leave that up for a while. But let's go ahead and tackle this other one that has just come in, discussing annual physical exams. We'll put that on the screen for you all to see. So the question, are annual physical exams still important even if you feel healthy? And again, that's a wonderful question, because a lot of people, I'm sure, would have that question and think that way. And they're saying, well, and that's why, unfortunately, we have so much um, inappropriate use of the emergency rooms. You know, we all see it where people come to the ER and say, because I have a headache, or um, am I truly pregnant, and things like that. And we say, yes, you are. So most likely, in those cases, the over-the-counter uh, pregnancy test that you might get from Walgreens or CVS is going to be about 90, 97, 98% accurate. So for some reason, I think a lot of people put faith into going to the ER, and they say, well, again, why the premise of that, our annual physical exam is still important if you feel healthy. A lot of people that are still young, and when I say young, let's say in their 20s, maybe even we'll give it up to 30, 35. They're saying, I've never had a problem. I don't have hypertension. I don't have diabetes. Um, so why do I need to go? And I think that's an excellent question. 1 second, we're getting something coming in on Facebook. Bear with us, everyone. Let's see. Oh, okay. We're letting everyone know about, and Facebook land, we've got a couple of comments there, and letting everyone know to log on right now for any questions. And this is, I don't know if you guys realize, but to have, and usually, like we said, we have the experts on with us. This is the time where when the judgment free zone, almost like Planet Fitness, if you will, something like that, where you can come on with us, join with us, and there's no judgment, there's no bad question. So we want to hear from you. But let's go back to that question. Uh, are annual physical exams still important even if you feel healthy? And the answer is absolutely yes. Absolutely, they are still important, because when you go, when people who say, well, I only go to the doctor when I'm sick, like I just go to urgent care to the ER, we're certainly grateful to have those resources, but those are supposed to be just like it's in the name, urgent care, emergency room, emergency department. And people say, well, what constitutes a true emergency? It is certainly not what we just discussed, which is a headache. Am I truly pregnant? Or, hey, I need blood pressure medicine refilled. So those are definitely not emergencies. So the importance of having a true annual physical exam is, number one, to have your physical exam to make sure all your numbers are right. And we're checking it for glucose. We're taking a look at your A1C to rule out diabetes. We're looking at your urinalysis to make sure you don't have a urinary tract infection. Lipid profile to look at your cholesterol. We're going to check your blood pressure. And the thing is about that annual physical exam, a lot of people say, again, as the question states, you're feeling healthy, you're walking around, you don't have headaches, you don't have migraines, you don't feel depressed, you're doing well at your job, making money, family's doing well. And the thing is, that's why they have always referred to hypertension as the silent killer, right? The silent killer, meaning that sometimes there are no actual associated symptoms. Silent killer. And so an annual physical exam would help to rule that out. We would be able to diagnose whether you have the silent killer. There's also certain types of heart attacks and chest pressures and just atypical ways that chest pain presents, or heart attacks and all that. And so when you have a primary care provider that knows you can help to tease out that information and say, well, because I know my patient, I know that this is abnormal for them. Something is not right. So it may not be, when it comes to people having heart attacks, that you have the usual chest pressure and tightness and heaviness or feels like an elephant is sitting on my chest. Those are usually, and especially they present that way in men, but a lot of times in women, they present very differently, and especially in women of other ethnicities. So that's very important to point out. So again, the answer to this question, for those, I see a couple of other people have logged on, the annual physical exam it is critically important, even if you do not feel unhealthy, or even if you feel healthy, rather. So that's the question there. Another question that has come on. What screenings should every adult be getting based on their age? What screenings, and let's put that up so all can see. There we go. The screenings that every adult should get. So like, we touched on some of this in our previous question. Very important to screen for diabetes. Okay. So that's 2 glucoses on separate occasions, or the most common way that we look at is A1C. This is a simple blood draw. If in the practices where you are able to obtain the results right there, usually about 30-40 minutes, and you'll have the answer. Right now, we're still doing a send off. So they'll be ready your results will be available the next day. But we can also do a finger stick in clinic. If we prick your finger and your blood sugar is 350, well, obviously you have diabetes, and we begin treatment immediately. But that's a very important one. Your blood pressure, we're screening for that when you come in. Everyone gets vital signs. And we've always, anytime that we've been on faculty with medical schools such as William Carey University, and precepting nurse practitioner and students alike, we always want to stress the importance of vital signs, right? And I tell every student, why are they called vital signs, right? They're called vital, the first word, vital signs. Because if you come in, again, you could be experiencing what we call, the silent killer, which is high blood pressure, which could lead to an actual killer, which is an MI or a heart attack, right? And every heart attack doesn't present the same. And so we're screening for your hypertension. So when we obtain your vital signs, we check your blood pressure, we can tell whether or not you have hypertension. And that is a non-invasive. We just put the blood pressure cuff on, give it a little squeeze, pump it up. And then in 30 seconds, we know what your blood pressure is. Same thing, we look at your heart rate. There are certain conditions and certain diagnoses that present with what we call tachycardia, or elevated heart rate greater than 100 beats per minute. Well, if you're resting, if you're sitting just like I am, just sitting down in the chair at a desk, your heart rate should not be beating that fast, nor should it be beating too slowly, which less than 55 or 60. That would be bradycardia. So that's on a whole nother spectrum. On the other end of the spectrum, where we would have concern, and we would need to see, are you symptomatic? Meaning, do you have any chest pain? Are you fatigued with either one? Do you have any sweating, nausea? All those things go along with it. And so we can make other decisions based on that. So the screenings for glucose, for diabetes, you would check A1C. In men, depending on the age and other risk factors, we check a PSA, prostate-specific antigen. Normal should be less than 4. If it's between 4 and 6, sometimes you can repeat it. If it's greater than 6 or 7, then they automatically get a referral to a urologist. So as you can see, so a man may come in saying, I've been dribbling urine a little bit, or I've been having my stream is not as strong. Some of that goes along with age. But I've been just noticing things, maybe even some lower abdominal or pelvic pain. And see, that's abnormal in a male. But if you're not going to your primary care provider and getting those things looked at and evaluated, you wouldn't know. Most people would miss it. And especially most male patients, because we all know that the number one reason that men go to the doctors, 2 reasons. And I always get a big laugh out of this. Number one, the woman that's in their life, be it their mother, their wife, their sister, their niece, granddaughter, whatever female relative that is closest to them, that's the person that's going to force them to say, oh, no, you are coming with me right now. That is top reasons, right? That's number one. It might even be tied with my second one. But the second one, is that a man comes to the doctor because he has a problem with his penis. Okay? So these are the reasons why most men go to the doctor. So you normally have to strong arm them. Unfortunately, most don't just go have their annual or biannual exam. And so they have to be dragged in. And so when you do that, then we unpack things like, yeah, doc, I've been dribbling urine. I've had a little blood in my urine. I've had a little weight loss even, and we can even tease out depression. There are certain questions on a PHQ-9 that you look at when it comes to depression. Do you feel safe at home? What your support system looks like. Are you working, or what consumes you? What do you enjoy most days? Are you in chronic pain most times? Do you have chronic headaches? All those things go along with it. And so these are things that we are screening for, not just diabetes and hypertension, but we go a little deeper, and especially at Good Faith Wellness, we're going to make sure that we tease out all of these things. We want to screen you for all of that. Shout out to Toya Love and Southern Gal on Instagram side. I think these are some. I don't recognize these names or faces. So thank you so much for joining us. We are Good Faith. We are. Telehealth Tuesday, your go-to podcast for modern insights and wellness solutions. Today's healthcare topic is all about you. And we have started with an icebreaker on today's episode. We want to hear from the audience and things that not only that you want to discuss, but also, as we stated at the top of the hour, we talked about, our annual physical exam still important, even if you feel healthy? And I think that is a fantastic question. It's a fantastic icebreaker in one of our initial questions. And because I feel like there are so many people who think that way, it's certainly not a bad question, not a dumb question. People think that way. And then our second question, just a quick recap, was what screenings should every adult be getting based on their age? And we went through that. We're talking about screening for high blood pressure, diabetes, but again, some things that other people don't discuss. We're talking about depression. Is there safety in the home? Is there any sign of neglect? And there could be elder neglect or even children's neglect or abuse. So we look at all that. That goes into taking a good social history. We talk about how much alcohol you're drinking, if any, how much, if you're smoking. And a lot of people say, when you say, well, do you smoke? We know now that you have to ask pointed questions. Do you smoke? We have to ask cigarettes, cigars, or even marijuana, because a lot of people feel that marijuana, they feel that it's not harmful. And they don't consider it in the same category in cigarettes. So let's go ahead and unpack that. Let's delve into that. Now, marijuana in the right person, certainly, or medical cannabis, can be very helpful when it comes to chronic pain, when it comes to depression, when it comes to your blood pressure, regulating blood pressure and diabetes. There are several studies out there that have showed lower A1Cs and especially lower blood pressure readings with people on medical cannabis. Now, again, this is not something you just go to the dispensary, especially in the states where it's legal. This is where you go to an actual physician and get screened to see if you're even a candidate for it. And then medical cannabis can be something that helps you. So we go into all those different things when we have our questionnaire, our initial intake with patients. Social history is so important. So let's get to another question that has come in. Talking about weight loss medications. I think this is an amazing question, and it is truly a hot topic. We're talking about weight loss medications, actually, and I have a telehealth appointment with a patient that we still have to get to. This is a patient of mine. She comes in every month. We have her on Wegovy, and I think she's lost about 16, 17 pounds, if my memory serves correct. So yes, in the right patient. The question is, are weight loss medications right for everyone? And as we all know, anybody who's taken tests for a living, has gone to either grad or professional school, or even with just any school, honestly, this day and age, we know, and people who are quote unquote good test takers know, there's never any absolute, there's never any emphatic or 100% question that is correct. So if you say, are weight loss medications right for everyone? Well, then the answer is no. just like if a person would say, well, then should weight loss medicine not be given to any patient? Well, you can't use those absolutes. So the answer to this question is no, but they're certainly correct. They're certainly correct for certain patients. Let's take one look here. Okay. All right. Shout out to Dr. Ardarian Pierre and David Pierre, the Pierre Docs. So they are watching. They have the children at a soccer game, but wanted me to know they're in support and plan to log on and maybe even give us a few questions or pointers. So a big shout out to them and their practice over David as a hospitalist, Dr. David Pierre with the Baptist system, and Dr. Ardarian Pierre is a geriatrician now with UMC. So thank you all so much for tuning in and support. But yes, the weight loss medications, certain people are not candidates, depending on your kidney function, your liver function. So that's also why it's not a good idea to go through the black market or whatever market, because now I think it's not even necessarily illegal. You can Google it and find just about any website, and you can obtain peptides. But you want to be very careful because not every person is a candidate for it. And the other thing is, so let's say a person's BMI, the body mass index, right? We're shooting for 24 and below BMI, right? So let's say someone's BMI is 22. So they're already at their goal based on, their body mass index, looking at height and weight, things like that. Not just only weight, but we're looking at height and weight, and it's a ratio that's called BMI. Well, if you're already at the goal, but you just want to, conveniently lose a few more pounds, then seeing that patient, it would not be a good idea. But see, a lot of people will say, well, I just want some Ozempic, doc, for 3 months and that's it. Well, this person is already at their goal, and with a BMI of 20, 21, might be even approaching being underweight. You see, so that's why this needs to go through a healthcare professional, and you don't just want to obtain things off the street or the black market or what have you. And so weight loss medications now, for somebody whose BMI is 38 or 40, like some patients that we take care of in the hospital, fully diabetic, blood pressure through the roof. Sometimes they'll have hypothyroidism or Hashimoto's thyroiditis. All those things kind of, when you put that together, then that patient desperately needs to get some of the weight off. And as we all know, in today's day and age, that's not so easy to do. A person might be a single parent. They might be working multiple jobs. They're tired all the time, even depressed. And so we all see it. We pay these memberships to gyms and never go, and they just collect from us every month. And so you see that patient who is already sick, morbidly obese, diabetic, all those things put together, they need to be on a peptide ASAP or some type of weight loss medication. They're also, the pills are still available. I know they're not as popular these days, and they have some side effects as well. But because of all the advertising and now the lowered costs of peptides being covered by Medicare, I believe Medicare now with Wegovy, it's down to $50 a month, which would be the copay for that for Medicare. Blue Cross, I believe, is covering certain ones. Medicaid does not, and there's no cash discount or incentive. So it behooves you to have actual insurance, because the cash prices, even with Good RX, right? The app called Good RX, you download that for free. The cheapest I've seen is $190 a month for Wegovy. That's one, and that is a huge improvement, because when all the especially starting with Ozempic, when all the peptides were released, when they were, first came out, brilliant advertising, millions and millions of Americans took the bait, and were paying between $500 and $1,000 a month for this, right? And so it's always the best answer to the question is, if you might think of, well, what would be more beneficial to a patient, using peptides to lose weight, or the old-fashioned way, which is walking, aerobic exercise. Walking is the best, most recommended exercise. And the answer will always be doing it the hard way, the natural way. But depending on the patient, again, some people do need a little boost, need a little hand, not even just a handout, but a hand up. So that's one thing we have to Let's see, we have to keep that in mind. Okay. All right, let's take a look here. Okay. Another question. Our next question is why are more young adults developing high blood pressure and diabetes? Mm. Why? The question again for those, for the folks in the back, as they say, why are more young adults developing hypertension and diabetes or high blood pressure? And as some people say in the South, the sugar. Um, And I think that's a very pertinent. Thank you for asking that. That is a very, very pertinent question to today, because in society we're seeing more. And I think one of the things that's really, disconcerting and just, you're seeing all these young people, and when I'm talking specifically 18 and under, even so, children, young adults that are walking around obese, morbidly obese. Even one the other day in Grenada, we saw a child who couldn't have been more than 10 years old and who appeared to have the same weight as his mother. The child was certainly over 100 pounds. And then, matter of fact, over the weekend at the hospital, there was a young man, 12 years old, and this is no lie, 12 years old, um, and this gentleman was running amok. I mean, in the emergency room, just terrorizing the nurses. Unfortunately, this morbidly obese 12-year-old boy had a behavioral disorder. We all know what his mother should have been doing to him to get him in line, but nevertheless, he was standing there, 12 years old, and he was just about the same weight as his mother. And so the question saying why are so many young adults developing high blood pressure and diabetes? It's because of what people are eating. It's because of oversalting the foods, the hormones, and all that, but also the portions. Right? We all have to do portion control. So you think about it. There was a restaurant in the Cayman Islands called the Wharf, and this restaurant served a piece of salmon. Now you might look at it, a piece of salmon. If you see this size, I would say if we were in Hollywood, they zoom in on this. But anyway, I got to do the manual zoom. So that's about 6 ounces, right? That is the appropriate serving of a piece of meat. Pause. So they had the appropriate serving. They had a scoop of either mashed potatoes or wild rice and whatever vegetable, what have you, asparagus or green beans or broccoli. I can't remember. It was a long time ago. But the point is that this is the reason why so many young adults are overweight. I'm looking at the food myself, and while in mid school, and saying, "Hey, I asked the gentleman, where's the rest of it? Where's the rest of the fish? Where's the rest of it?" And he kind of laughed and chuckled and says, "Well, if you'd like another serving, sir, we'd have to charge you, but we can certainly make that happen." And so my point is, we are consuming too much. We are eating too much food. And so we're taking in too many calories. That's why you're seeing so much more obesity, and especially juvenile obesity. And now, even in the schools, a lot of schools, because of the government and different things, they're not allowing recess. And, people who identify a certain way, and little, young boys who are saying, I identify a certain way, and they don't feel comfortable dressing out in the gym. They want to go in the girls' room, and society is allowing it. All this crazy crap that is going on. So then kids are allowed to not partake in recess. Not be active. And so instead, they're allowed to maybe have a snack and just sit around. So we create lethargic, or we create young people who are sitting around, more lazy behavior, apathy, and all that. And so when they get to these states, being young adults and all that, they already have pre-diabetes. Going into diabetes, they already have higher blood pressures, and it's so sad, because a lot of this stuff, even though people have this family history, we don't want to just blame that. This is easily treatable and even sometimes preventable with a good screening from your primary care doctor, which leads me into another shameless plug. Good Faith Wellness Center is, in fact, taking new patients as soon as 7:30 a.m. tomorrow. We are also planning to open up for walk-ins. So we'll let you know. We're going to have an amazing flyer. Hopefully it'll catch your attention. You'll see it. It's going to be on the ads on social media, and it'll let you know exactly when we will start the walk-in appointments. And we've even done some weekend or Saturday appointments before to take care of patients who are not able to come see us during the week, or who may be working, or single parents, different things like that. So, but we want to make sure that you're being screened for these things. Like we're talking about young people, young adults with high blood pressure and diabetes. This can be treated. Okay. All right. Another question that's come to us is how much water, or actually, I think we kind of beat that one as a dead horse. Is walking enough exercise to improve your health? Is walking, and I would love to hear from some of you if you guys are still out there. If you're here with us, if you're paying attention, let us know. Do you feel like I know the answer, but do you all think that is walking enough exercise to improve your health, right? And some people will say, well, why don't you qualify that a little bit or quantify it? How much walk? Well, we're talking about out of 7 days in a week, so 4 days a week. So the majority of the week, we're talking about walking. Now, the walking has to be in a certain way. You see, it can't just be, and I've told my mother this, it can't just be walking around in your comfortable home, air conditioned, blowing, everything going well, watching TV. And so you're not counting on you're not concentrating on your steps. You're not concentrating on your breathing. You're not concentrating on getting those elbows up high enough. You see what I'm saying? That's why you see people walking around. They look kind of silly. And they'll have these weighted vests on, with things on their arms, and they're just getting it out there on the side, on the sidewalks and everything. This is the type of aerobic exercise and walking we're talking about. Brisk walking. Okay, now if you can't do that, some is definitely better than none. If you're somebody who is not as mobile, maybe you have to utilize a rollator or walker device or something like that. Then in that case, anything is better than nothing. So walking around the house, you have to see how many feet, depends on how many square feet the house is. You really want to get in about a mile. If you can, you get in about a mile. For most people walking, that's going to take about 30 to 40 minutes, something like that, to walk a mile. It's just a regular pace. Now, jogging, you probably cut that in half, or if you're on these machines and ellipticals, you set it for 30 minutes and you're really killing it on the machine. We've gotten up to about 2.8 miles ourselves on the treadmill. In about 45 minutes, we do almost close to 3 miles. And we're burning 300 to 400 calories minimum. So we want to do at least 1 mile, and we want to burn at least 300 calories. These are minimums, right? So if you can do 1 mile that way and then 1 mile coming back, then you'll double the calories. So that's even better. And for diabetics, the ADA diet, American Diabetes Association, right? How many carbs should I be taking in? Now, as a diabetic, 1,800. Obese or morbidly obese diabetics, we let them go to 2,000 calories, okay? Calories in a day. So the average human being, how many calories is somebody taking a day? Well, if we're not doing portion control and we're eating large slabs of meat, large slabs of it, doubling up on mashed potatoes, doubling up on the wild rice and all those delicious things we like, and then those Red Lobster biscuits or Texas toast or whatever it is, and doubling up on all those carbs, we're probably looking at the average adult doing between 2,500 and 3,000 calories with their meals. So in a day's time, definitely. So with things like factor meals and all that, if you're truly watching your weight, watching your calories, they have meals, and this is certainly not an advertisement or shame, but this is just something that we've had personal experience with. We're talking 600 to 700 calories per meal. The little trays they send on dry ice or however they do it in a box, and they deliver it to your door. And so it's basically a way of doing meal prep. You can just slide it into the microwave and heat it up when you're ready. And so we're talking about with the Weight Watchers type of product that they have, we're talking 600 to 700 calories in each one. So if you do 3 of those in a day, breakfast, lunch, and dinner, you should be right at 2,000, 2,100 calories in a day, which is excellent, especially for a non-diabetic. And so that's why. But going back to that question, walking enough exercise to improve your health, absolutely. Even if it's not brisk walking. Now, we mainly want to do brisk walking. But if we can't do brisk walking, then even any exercise, anything that's going to get your heart rate up, get your breathing a little faster, that is the goal. That's what we want to do. Let's see. We've got a couple more questions. Warning signs. One question that has come in that's been submitted. These warning signs. What are warning signs that should never, ever be ignored? I see Diane Powell on Instagram land. If you're still there, please drop us a shout over there on Instagram land. I don't know if you guys can. These are separate platforms, so you can't see the Instagram folks. But MT Rankin, big shout out to ISI Fitness in Flowood, Mississippi. ISI Fitness in Flowood, the owner has been a proud member of the Kansas City Chiefs. So if there's any Chiefs fans out there, big shout out to you. So I don't know if you're still on there, Martinez, but we're proud of everything you're doing with ISI Fitness. And I believe you guys are still taking on new clients, and they're always running a special every month. So check out ISI Fitness when it comes to that. But yes, walking definitely enough exercise to improve our health. Yes, so we're going on to the warning signs that should never, ever be ignored. What are the warning signs that should never be ignored? That is a great question, and I'm so glad somebody asked. So we want to make sure when it comes to warning signs, different types of chest pain, I would say, is one thing, right? Different types of chest pain should never be ignored. This is particularly important in male patients because male patients get this more typical or pathognomonic way of showing, like the what we call the MI or heart attack has a way of showing itself, especially in men, more violent ways, more obvious signs like we talked about: chest pressure, chest tightness, an elephant sitting on my chest, those kind of things. That should never be ignored. Okay. Blood in the stool. Now, unless you have proven and documented hemorrhoids, blood in the stool. Now, and we're not just talking about a little bit of blood when you wipe back there. We're talking about actual, you know the difference. And so that's something that should never be ignored because it can be multiple things. That can definitely be multiple things. And so you have to be careful with that. Unintentional weight loss, that's pretty severe. So if you say, oh my goodness, I'm 2 pounds down or 5 pounds, that's okay. And for the most part, most people, we could all stand to lose a little weight. Okay. But if we're talking about, 10 to 15 pounds or more in, say, a 3-month time spent, that is concerning. So that should never be ignored. Abnormal or unintentional weight loss greater than 10 to 15 pounds is something that's a board exam question. It's something that should never be ignored. And so that's why you need to get to your primary care provider as soon as possible to get that evaluated. There's certain labs we check. There's certain inflammatory markers we check. Then also just the routine screening. If you're 45 and over, you've never had a colonoscopy, we need to take a look at that. We need to check your blood counts. We need to check your serum iron level to see if it's iron deficiency anemia, because if it is and you've never had a colonoscopy and there's family history of colon cancer, well, this could be something more sinister, something really worrisome, especially with iron, or especially with microcytic anemia. Not iron deficiency as well, but microcytosis, meaning that the blood cells are smaller, micro. So if you see a microcytic anemia, which means low blood counts, that's something to be concerned for, and it could very likely be cancer. So the warning signs that should never be ignored. You never want to ignore issues with your urination. So if it's burning and stinging, there's an obvious redness, and you're not on Peridium or you're not on other things like that, you want to make sure that this is not a urinary tract infection or something else, more worrisome or more concerning. So that's something as well. I know that we're almost out of time. Believe it or not, it is 7:56. Um, how does stress affect your physical health? That is an amazing question. Let's put it up there for all to see. Let's see. We got to let's reply to this message here that is just coming in. Okay. How does stress affect your physical health? Stress, oh my goodness. So, a lot of times, a lot of things that we see, let's see what a lot of things we see in healthcare, so they manifest themselves in strange ways. So, stress, one thing that is so, when it comes to diabetes, especially high blood pressure, hypertension, when people are stressed out, during COVID, people aren't working, didn't know how they were going to pay their bills. A lot of us included are people losing jobs, getting phased out, all that's right. So a lot of people, even though they're on the optimal blood pressure medicine and therapy, still we're seeing our numbers climb, blood pressure readings. And so we have to be very, very careful. Stress is something that is just terrible and it wreaks havoc on the body. It's just like with cancer that feeds on certain things and when your body is more acidic. So when you're more stressed, then the body's more acidic, and that's also why that's even somewhat of a precursor to cancer, because the body is in this chaotic state, and so stress certainly, definitely affects your physical health. We look at it, we can see those changes in your blood pressure and your heart rate. Like we said, there's a relationship with cancer. Um, and when it comes to even diabetes, we saw about 2 weeks ago in the hospital, DKA, diabetic ketoacidosis. People that are diabetics, unfortunately, I'm sure you've probably heard of this, or known somebody who's had it or likely died from it. Life threatening. This is a life threatening ordeal. The body is truly in a state of ketosis and uh, absolute survival, fighting to just stay alive. And so, stress, most likely, when people have an infection like urinary tract infection or pneumonia, things like that, and they're not eating properly, not taking their insulin, all that. A lot of them experience DKA, and how that's treated is that you're hospitalized and you're in the ICU, and you're on an insulin infusion in the IV. So insulin going through your bloodstream, not just subcutaneously. When somebody gives insulin in the thigh or in the stomach area, this is you're getting an IV, and this is going through your bloodstream, circulating all through your body. So big shout out to the Conscious Smile, Ware Family Dental in Grenada, Mississippi. Good to see you on there again, the Conscious Smile. We got it right this time. I got you. But yes, stress is the whole show. She says, wow. Thank you so much for that comment, because I couldn't agree more with you, Dr. Ware, that stress certainly is the whole show. That is the question, the point. Stress, and I'm sure if you want to make any comments, Dr. Ware, on how that affects your teeth, the enamel, people who are needing root canals and have a lot of cavities. Of course, that's other things going on with lack of flossing and brushing and eating the wrong food, drinking black coffee that stains your teeth, all those things. But the stress is something that would even make somebody cancel your surgery because your blood pressure shoots up. You're not going to be a good surgical candidate because they might have bad outcomes. So you see how just being stressed out can affect, like we said, hypertension, diabetes, your just your overall feeling, being depressed, all of that. So stress is certainly, I'm going to label it as a killer. Stress is certainly a killer. Um, and so we want to take the last question. We have a prepared question, but also, since Dr. Ware, I know that you put your comment. If you have any thing that you'd like to add, any comments, questions, concerns, or from the audience, I think I see a couple other new people. Big shout out to our Instagram followers and supporters. If you guys have anything that's on your mind or any burning questions, or let us know, please. But the question that we have for you One healthy habit that everyone should start this week, and that's what we want to close off. That's what we want to close on with that. The one healthy habit. Let's get that on the screen. One healthy habit everyone should start this week. And if you guys have any thoughts on that, we would love to hear from you. Let's see. There we go. Okay. One healthy habit that everyone should start this week. We'll go ahead and start off and say, I want to say that pretty basically, unless somebody has a true pulmonary, like a lung issue where, you're on oxygen and all that, then yeah, this comment with this recommendation is not for you. But let's just say the average person out there, or even just the average person who may have hypertension, diabetes, thyroid disorder, and especially for those that are overweight or obese, the first healthy habit that everyone should start this week, that is recommended from Good Faith Wellness Center and Dr. BTV is, what is it? What is it? I think we should have like a drum roll. Dun, 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 dun. Walking. I don't know if you guessed it, but definitely walking. That is one healthy habit that everyone should start this week for sure. So let's get out there. Let's either, if you're a gym person, or if you have a gym in your home, you have a treadmill, you have a elliptical or whatever, then make sure to actually use it. Okay. If you don't, if you're a first time, you're a person who just want to get started, then I commend you for that. But let's try to do it either on a track or outside or somewhere where you have enough space to get a mile in, working on your breathing, working on all those things, swinging those arms. And if you're confined more so to the house, or you use a rollator device or rolling walker, then let's do some laps around the house, okay? Or even just down the driveway and back, in the house, driveway and back. So we want to, that's one healthy habit that everyone should start this week, walking. Okay. And when it comes to nutrition, then, we want to say, let's hold off. Let's increase our protein and vegetable intake and decrease the carbs. So that would be the other suggestion. Walking is the physical healthy habit that everyone should start this week. And dietary wise, let's look at increasing our protein, increasing our vegetable intake, especially leafy greens, unless you're on Coumadin, right? That's why this doesn't apply to everyone. But if you're not on Coumadin, which is a blood thinner, because that's contraindicated, Coumadin, let's do that. And let's get off basically you could say anything white rice, white rice, white bread, anything white, potatoes, all that good stuff that we love to eat. French fries, white French fries, regular potato, Idaho potato fries, all that. Let's put it down this week, and let's concentrate on some lean meat, some good lean protein, increasing our vegetable intake and fruits as well. All right. So we want you guys to know. Thank you so much, by the way, for sticking with us. This is episode 104. Episode 104. Give yourselves a round of applause. So thank you all for sticking with us. Telehealth Tuesday for 104 episodes. Thanks and glory be to God that we have not missed a single episode. And so we're so thankful for that. So again, Good Faith Wellness Center, we're taking new patients. If you don't have a doctor, well, how you do? We'd love to see you. If you have insurance, great. We take every single payer. If you don't, we have a plan for you, $99 a month for unlimited individual visits to Good Faith Wellness Center. Now, make note, this is not health insurance, so do not go to the hospitals and say that I have Good Faith Wellness Center plan or the Bookheart Care plan or whatever. You will be promptly turned away. All right, so don't do that, and don't tell them I sent you. But come on down. We want to prevent you from going to the hospital, prevent these things. We want to prevent DKA, the complication of diabetes. We want to prevent MI, which is a heart attack, complication related to stress and high blood pressure and all that, strokes. So that's the purpose of having a primary care provider, to get screened for certain things, cancers and all that, diabetes, hypertension. And if you have these unfortunate things, to prevent further complications. This is what we are here for. By the way, If there's anybody that you want to see on here, if you want to be a guest, DM us, drop us a line, goodfaithwellnesscenter@gmail.com, or also on our Facebook, Instagram pages. Like, and don't remember to share, tag, like, follow, click subscribe, right? Follow, subscribe to Dr. B TV, DOCTOR, the letter B, TV on YouTube to make it count. Got to click subscribe. All right. So, God willing, we will see you always on a Tuesday. This is the place where we treat and discuss mind, body, and soul. And remember, as always, that true wealth begins with good health. See you next Tuesday. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. I'm Dr.